Hey there, functional medicine practitioners. We sure do run a lot of stool tests in this industry, and what I'm about to show you is evidence that perhaps things are a little bit more complex than we realize, and that maybe we shouldn't run them as much. In fact, I used to run stool tests quite a bit in my practice, and I have, over time, through the evaluation of these tests and the protocols and the interventions and the outcomes, as well as conversations with other practitioners who I respect and their observations and therapeutic interventions and outcomes, as well as split sample testing, as well as what you're about to see in the scientific literature, I think that we're overrunning these stool tests and interpreting far too much from them. Let's take a look. Here's a paper. Now look at the title of this, Clinician's Guide to Microbiome Testing. Now, first of all, most researchers, when they do research, are talking to other researchers and how to do better research. A lot of times they're not talking to clinicians, nor are they trying to make their way into the clinical world, which is super unfortunate. But check out this one. They say that, and look at this closely, we caution patients and providers that the current microbiome tests, given the state of knowledge and technology, do not provide much value in clinical decisions. Considerable research remains to be carried out to make this objective reality. They go on to say, while the premise behind individual microbiome testing is to inform personalized diagnosis and therapies. Now, that is what practitioners are using them for. I'm aware of that. They have good intentions. They're using a stool test to inform personalized diagnosis and therapies. However, they go on to say that the current body of knowledge is not sufficient to allow for meaningful diagnosis, given the high degree of inter-individual variability. And in a second, we're going to look at intra-individual variability in the microbiome and the severe limitations of commonly used analytic methods, that there's not sufficient knowledge. They go on to say, and we'll finish here, the obvious risk of applying such technologies to diagnosis of infectious diseases is to increase unnecessary confirmatory testing, number one. Number two, provoke unjustified patient anxiety. Now, if you're a patient and you've had a stool test run and you've seen the results, I guarantee there are so many patients that have become anxious about their test results. And the unfortunate thing is they may have been poor test results, as well as to compel patients to embark on useless or harmful therapies. Once again, run a stool test, change your diet, take some supplements, sometimes harsh, a variety of different things. Symptoms don't go away. Stool tests don't necessarily change. And so for these reasons, they say that the diagnosis of infectious disease should be based solely on highly specific targeted diagnostic assays that have been thoroughly validated, which many of the stool tests in our industry have not been. Now, that's looking at one particular perspective. Here's another one. Now, this was a paper that was done on disease-free Swedish individuals. There were 75 of them, and they submitted 4 stool samples over the course of a year. They had good exclusion criteria for this as well. They say that here we use whole genome metagenomic and 16S RNA gene sequencing, so not culture testing, to characterize the intra and inter-individual variations of gut microbiota composition in a functional potential of a disease-free Swedish population over a year. They didn't just look at the composition, they also looked at the functional potential of these microbiome as well. And what they found was that 23% of the total compositional variance, which is enough, it's a lot, was explained by intra-individual variation. That's variation within a single individual, not inter, which would be within the group. Thus, reliable quantification of microbial features requires repeated samples. Notice what it says there. Repeated samples to address the issue of intra-individual variations of the gut microbiota. Now, this is just a couple of many papers. There's many more papers that talk about how much diet, some internal variables, some external variables can influence our day-to-day microbial variations, as well as inter-individual variations as well, which comes into play when we're looking at things like reference ranges. The last thing this paper talked about was the function of the bacteria. So they might see a different amount or quantity, that might change, but the function also changed, and they suggested it changed over a year. So anyhow, the overall summary is, assuming that the lab itself that you're using is accurate, which I think is highly questionable, especially with some of the stool testing labs out there today, the only real function of these stool tests is to look for a significant and specific infection, like a big parasite infection, big fungal infection, some type of bacterial infection, opportunistic pathogenic bacteria, and that's about it. The rest of the microbiome is far too complex to bother testing, and if we continue to do this, I think that we're wasting our time and our patients' money. If you like this kind of information and want to learn more, check out metabolicfitnesspro.com. God bless.